For Rooks, and this is Maine Calling. If there were a prize for Maine Calling's most frequent guest, or for the person who gets the most questions from the audience, or for the most song lyric quoting CDC director, it would go to today's guest, Maine CDC Director Nirav Shah. Today will be the last time I introduce him that way. As of March, Dr. Shah will take on a new position at the U.S. CDC. We welcome him back to talk about what that job will entail, and as always, to take your questions about the pandemic, vaccines, the flu, and whatever else is on your mind. We invite you to join the conversations. What questions do you have for Dr. Shah? What impact has he had on you? Send an email to talk@mainepublic.org, post a comment on social media, or give us a call at 1-800-399-3566. Welcome back, Dr. Shah. And we've lost count of how many times I've said that.
Well, thank you for having me back. Each and every episode is a pleasure and a privilege. So I'm delighted to be back one more time.
And we are feeling bittersweet right now. So sad that you'll be leaving Maine, but happy for you that you're going to be taking on such a significant role at the national level. Congratulations, and tell us about the new position.
Well, thank you. And I too feel a little bit bittersweet as well. It's not easy to leave the team at Maine CDC, to say nothing of the community that my family in here and I have found here in Maine. But when you get called up, you go. And even though we're going to be keeping our house here in Maine, I'll have to be down in Atlanta and other places where the CDC is operative. So it's going to be a bit of a change, but it's not a permanent change because Maine is still our home and we'll be back. But I'm excited about the challenge, and I'm excited to work with Dr. Walensky and her team. My primary job will be to be her alter ego of a sort, to make sure that if she's tied up, the agency down there is still operating. But that being said, there are certain areas where Dr. Walensky has asked me to focus, making sure the vast laboratories at the CDC are doing what they need to do to be prepared for the next pandemic, making sure that the data that the agency has are equally robust and ready to inform decision-making, to say nothing of the work around communications, policy making, and just keeping the lights on. So there's a lot of work to be done. I'm excited about that next chapter, but I'm equally sad to be departing the Maine CDC.
We will be asking you questions about public health. Imagine that in just a minute. But first, we're going to take a walk down memory lane, and we're going to start with the first time you were on Maine Calling. I don't know if you even remember this. This was in September of 2019.
Well, thank you for having me. What we've learned in the past several months in the scientific and public health community is that there's a new type of illness that's been out there that we're now detecting, wherein individuals who have used vaping or e-cigarette products, a certain fraction of them are coming down with a very severe lung disease. Sadly, there have been a number of deaths across the country. We at the Maine CDC are actively investigating and monitoring the situation.
Not to downplay the importance of vaping, but we clearly had no idea what was coming.
We were so young. I can't believe that. That those were, in reference to the lung diseases that were caused by vaping. And it was almost a practice run for the larger epidemics that were to come. I do remember being down in the studio discussing that with you and other guests. And it's my first introduction to public radio in Maine and the reach of Maine Calling.
Then we're going to just fast forward a little bit to February 10th, 2020.
As of right now, according to the US CDC as well as the Maine CDC, the overall risk of coronavirus to anybody in Maine, anybody in the country, is very low. Based on, as of right now, there are no confirmed cases of coronavirus in Maine.
If only we'd stayed that way.
Oh boy. Well, one of the things we've learned about a pandemic is that what happens on Monday will not necessarily be what happens on Tuesday or Wednesday. We all had a lot of learning to do back then.
Oh my gosh. So only one more. And this one, we're going to go forward. This is, I believe, last year, when it was January of last year. You have had an eagerness to take on really tough questions from our listeners. And you even asked us if we could do a show inviting people who are skeptical about the COVID vaccine to call in. And that was January of last year. And here's a little tiny clip from Sean, who had called in with reservations about the vaccine. And here he is after you talked to him.
I'm glad that you were able to talk to me because maybe I will get the vaccine.
That was a pretty powerful moment.
It was. It was probably one of the most memorable moments that I, on a personal level, have had in the pandemic. It's really critical because it's the power of conversation. There's nothing magical. There's not this secret formula. It's simply sitting down and respecting people's questions, treating them like adults and answering them earnestly. That is the only way that you can really ever hope to make progress, particularly seeking out those with whom you disagree. I'm so thankful for you, Jennifer, and Cindy, and the entire Maine Calling and Maine Public team for giving us the opportunity to have these conversations. That clip that you just played displays the power of one simple conversation. It's really instrumental and critical.
It feels as though Maine has been a bit of an outlier in this regard, probably in large part because of your leadership, Dr. Shah. But it seems as though you're headed to a job where you're going to help lead the CDC when the nation is not having conversations.
That's right. That's going to be a challenge. Let me first start, though, by noting, Jen, that it's not just me. Leadership starts at the top. It was Governor Mills and Commissioner Lambrou who set the tone for what we were going to be doing and cleared the path to make sure that science could lead the way. And even though I'm going to be gone, public health in Maine doesn't center around one person at the Maine CDC. I leave the agency in a much better and stronger place than when I first came 3.5 years ago. So public health in Maine is on a strong footing thanks to those things. But you're right, public health at the national level, we've got work to do, both on the infrastructure side as well as, and I think most critically, on the trust building side. There is this notion that trust is a transactional thing, and it's not. Trust is something, as your clip with Sean demonstrates, trust is something that's built one conversation at a time. And that's one of the things I'm hoping to work on. The US CDC has a long ways to go to regaining some of the trust of a lot of people in the United States. Half the people in the country right now think that we did way too much during COVID, and the other half think that we didn't do nearly enough. So there's got to be a happy medium there. Finding that middle ground through repeated conversations is going to be tough, but I'm hoping that the team there and I are up for the challenge.
Of course, because you're here and you are still head of Maine CDC, I have to ask you questions. I understand that Maine has had a case of congenital syphilis. Is congenital syphilis the formal name for what we've thought of as syphilis all these years, or is this something else?
It's a variation of that. Congenital syphilis, and we did detect a case here in Maine, is syphilis that was passed on from the mother to the child. So the child was born with it. It's serious. And the reason why we were concerned about it and the reason we wanted to alert clinicians of it is twofold. The first is that it's easily treatable by screening pregnant people during pregnancy for a number of diseases, including syphilis. And then if that's positive, administering an antibiotic, that type of transmission can largely be avoided. But the other thing it tells us is that it signifies that there's been a breakdown in the system somewhere. When that type of prenatal screening does not happen, when that antibiotic is not administered, that's a sentinel event that tells us we've got to do a deeper dive. That's what the team at the Maine CDC has been doing to figure out how this happened and what we can do to prevent more in the future. It's a concern because of what it tells us about the system, rather than for what it tells us about the risk to the public.
Let's talk about the COVID pandemic. I'm sure that you nor anybody else in the audience was thinking that we would still be talking about more and more cases. I know several people who have come down with COVID very recently. I know somebody who has died. Where are we, Dr. Shah?
That the COVID pandemic is going to be with us, and every few months there's going to be the next new variant that exhibits traits and tendencies that suggest that another wave is coming. And one of these times, another wave might actually be on its way. Fortunately, with the latest variant, the so-called XBB variant, the wave that many were deeply worried about hasn't materialized yet, although it still very much might. And that's for a number of reasons. Even though this latest variant is better at escaping the immune system's protections, there are already significant numbers of people in Maine who already have immunity built up, either because they did the hard work of getting vaccinated, which is about 95% of people in Maine with at least one dose, or they already had COVID. When you take those two things together, you end up with about 96+% of people having some degree, varying degrees of immunity on board. And that's why, even though there was a lot of concern, we haven't seen wave after wave of COVID crashing onto us. Thankfully, right now, with not just COVID, but the other two infectious diseases that we were worried about, influenza and RSV, rates have actually come down significantly. That's good news, but it's also a reminder that those things have happened because of the work we've done. People went out and got their COVID booster. It's not too late to do that if you haven't gotten your COVID booster. A lot of people got their flu shot. It's not too late to get your flu shot, because in particular, there might be another wave later in the winter or in the spring. So the message there is that thankfully the triple-demic that many were concerned about hasn't yet materialized, but it is still critical to go get your COVID booster and your flu shot if you haven't done so already.
Today's news that the FDA is considering a new approach in how people get vaccinated for COVID-19, which would be more like the annual flu shot. Can you elaborate on this? Is this something that you agree with, and why this new strategy?
Well, ultimately that decision will turn on the data. But the question that I've seen a lot on social media, and you referenced, Jen, is, okay, I got my updated booster. I got my updated booster right when they came out. What do I do now in order to maintain that optimum protection? Will I need a flu shot or a COVID shot every year, like I do with the flu shot, or will it be every few years? This is something that the FDA and the CDC have been discussing. Ultimately, it will turn on the data. Partly the data around what the virus is doing, but also the data around how our vaccines are able to keep up with the latest version. It's possible that the COVID shot will become something like your flu shot that you get once a year. It's also possible that it'll be something that's less frequent. Ultimately, that will be determined by the scientists, but I'm glad that the FDA and the CDC are thinking about the future right now. That's really what's key.
I want to ask you about people's behavior. Most places you go, most people are not masked. The doctor's office, they are, theaters, they are, but pretty much it's not the norm. Is that okay?
It really does vary person to person, family to family. I will say, when my family and I go out to dinner at a restaurant, we're not wearing a mask, partly because we're eating and such. But if we're on a flight, we routinely mask. We haven't been to a concert in a while, but the last time we went to a concert, we masked during the concert. Some families, that's the right thing to do. In our family, that's the right approach. We have elderly parents who have various and numerous health conditions, and we want to keep them as safe as possible. Other families, that's not necessarily what they need to do. Maybe they don't come into contact with older or immune compromised folks at all or on a regular basis, and so they may not need to mask anymore at all. It's important to remember that COVID now is not what it was 1 year ago, let alone 2.5 years ago. Not only do we have superb vaccines available, we also have treatments available. One in particular, Paxlovid, remains effective against COVID-19. However, and this is the other key I want to leave folks with, getting Paxlovid takes a little bit of legwork still. I recommend that everyone have a plan for what to do in case you or your family member test positive for COVID and needs to get the drug. Call your doctor's office now rather than when the clock is ticking and you need to get access to it ASAP.
Dr. Shah, there are a lot of questions about these COVID tests that we've all been getting in the mail, either from the state or from Medicare or our insurance company. At first, we were told if they were expired, that was okay, just use it anyway. Now the advice is a little more nuanced, isn't it?
It is. It's hard doing easy to apply bright line advice in a pandemic because everything entails a high degree of nuance. And our way of communicating nowadays by Twitter and other such ways doesn't really capture nuance. So you're right, Jen. The tests that are sent out by the state of Maine, as well as by the federal government, are, like all things, medical products. And like all medical products, they have a shelf life. However, the longer the tests have been on the market, the longer we found that they are still good. In fact, just last week, the FDA extended the shelf life once again. The best thing to do if you've received one of those tests from the state of Maine's program or the federal government's program is to go back to the website really quickly, because that is where the latest information about the viability, the usability of those tests will be posted. Again, they just extended the shelf life just on Friday. And so in all likelihood, if you've received tests recently, those are in good shape. But if you have concerns, the lot number can be checked online very easily. And that way you can confirm that the test you've got is still viable.
All right. So we will find information about how to check that lot number and put it on our Facebook page. And we'll also put that on our weekly newsletter. Of course, we're speaking with Dr. Nirav Shah, the outgoing director of the Maine CDC. Love to hear your questions. Also, if you'd like to talk about how Dr. Shah's words have made an impact on you, our phone number, 1-800-399-3566, our email address, and please make that email short, talk@mainepublic.org, or you can find us on social media. We'll be right back.
Listener support brings us Maine Calling, with help from Terlingua Restaurant and Market in Portland, offering Texas-style barbecue, tacos, and ceviche. Reservations at terlingua.me. By Eco Maine, reminding you that recycling works for Maine. Learn how you can help keep another 1 billion pounds out of Maine landfills at ecomaine.org. And by Maine Community Foundation, working to bring people and resources together to build a better Maine. Learn more at mainecf.org.
Azmat Khan won a Pulitzer for exposing the deadly consequences of the war on terror.
Americans are being sold a myth about warfare, right? Americans have a right to know what the true costs of war are in order to make informed decisions.
Hi, I'm Ray Suarez. On this episode of On Shifting Ground, Khan and Shannon French on the lost people and lost data in overseas military raids.
And you can hear that broadcast this afternoon at 2 p.m. here on Maine Public Radio. Maine Public is pleased to be a media sponsor of the Portland Symphony Orchestra's performance of The Rite of Spring. Join music director Eckhard Proy and the PSO as they perform Stravinsky's groundbreaking and iconic work on Sunday afternoon, January 29th, and Monday evening, January 30th, at Portland's Merrill Auditorium. Maine Public members are eligible for 15% off tickets to the concerts. For complete details, please visit mainepublic.org and click on Events.
Welcome back. This is Maine Calling. I'm Jennifer Rooks. Our guest today, departing Maine CDC Director Nirav Shah. He's moving on to a top position with the National CDC in March, and he is here to do what he has done for the people of Maine for 3 years, answer your questions about COVID and more. You can send your question in by email, talk@mainepublic.org. Post a comment on social media, or give us a call at 1-800-399-3566. And yes, we are streaming this program. You can go on to YouTube and search Maine Public to watch this interview instead of just listening to it. If you'd like to, we are talking via Zoom. Let's see. I'll start with going to Janice in Somerville. Hi, Janice. Go ahead.
Hi. Yes. I had one question about boosters. I got my 2 boosters. The first one was in February of last year and then September of last year. And I'm just wondering, is there any prescribed, time frame for whether I should get another booster or not? I am immunocompromised.
Well, hey, Janice, thanks for that question. That question has come up a lot. And I'm glad you raised it. Right now, you are in good stead. You have got the maximum protection afforded by vaccines that's available. I'm glad that you got your bivalent or your updated booster as soon as it came out too. That's really important. The protection that you got from that booster in September is still very much on board and is helping to keep you safe. So right now, there is not a recommendation to get another bivalent booster. There may be at some point in the future, as Jennifer referenced, the FDA and the CDC are discussing what the future of boosters might look like. But Janice, for right now, you have got all the right protection on board to help keep you safe from COVID. And I'm glad that you've done that.
Janice, thank you for your call. This is a fun tweet from Caroline. She has two questions. I'm going to read both of them. One, what would you personally feel comfortable doing right now? Going out to eat, gathering at home with 10 people, none of the above? And number two, what song, if you had to pick only one, exemplifies your time as Maine CDC director and why?
Okay, let's answer the first while I think about the second. So what do I feel comfortable doing right now? And we mentioned this a moment ago, Jennifer. You know, my family and I, we're somewhere in the middle right now. On the interstate, we're going about 70 miles an hour, not too fast, not too slow. We do go out to eat, but we tend to go to restaurants that are a little bit more spacious rather than ones that are closed and tightly packed. We do have friends over, partly because a lot of our friends have either had COVID or are 100% boosted. We have gone to concerts, but when we do so, especially if they're packed, we wear a mask. We do fly, of course, but when we do so, we still wear a mask on planes. Even though the air circulation is very good, you might be close to somebody who's not feeling so hot. So in large part, the things that we do in our lives are back to the pre-COVID era. We go to the gym, et cetera, but with occasional modifications, if it's really densely packed and such. It's going to be different for every family, though. And so what my family and I do should not be taken as a bellwether for what other families ought to do, because it's so particularized. And then what one song symbolizes my time? I think it would have to be the Bill Withers song. It's I forget the name, but the song where it's a sunny day. I think that would be the song, even though it's snowing today. And even though during my time in Maine, we contended with numerous health challenges, at the end of the day, it was always optimistic and sunny. And so I think Bill Withers hit it right on the head with that particular song.
That was quick thinking. I'm impressed. We're going to go to Ellery calling from Waterville. Hi, Ellery. Go ahead.
Yes, and thank you for an incredible program, and thank you for taking my call. Dr. Shah, I hope your new position affords every opportunity to do what you do best, do so well, which is communicate and educate. So I thank you for that. Now, moving on, considering the communicability of this latest COVID variant, I was wondering if different or better masks than N95 be more advantageous, because I see so many people wearing ill-fitting masks and masks draped under their noses or loose. I still have a bugaboo about having the right mask.
Well, Ellery, it's you raise a great question. First of all, thank you for your warm wishes. That is very kind of you. And masks remain important, and I'm glad that you raised that. There are, as you note, varying degrees of masks. N95s are about the top end for what most folks can usually wear for a decent amount of time. And so anytime we talk about masking, we're talking about a bit of a trade-off between wearability in the long term and its ability to keep you safe. N95s, for those who really want maximum protection, are about the top end of what you want to be doing, or what is available for you. Surgical masks, however, the ones that we've grown accustomed to seeing everywhere, surgical masks are still a very, very good option. Maybe not as robust as N95s, but when worn properly, as you note, when worn properly, a good old blue surgical mask still does a really good job of keeping you safe. If you're looking for something above and beyond that, though, the N95 is the way to go. And so masking remains important. And having a good, proper fitting mask is really the key to that equation.
All right, Ellery, thanks for calling. We'll go up to Holton and Karen. Hi, Karen. Go ahead.
Good morning. Dr. Shah, you established such a wonderful trust in we Maine citizens and our concerns about the pandemic. And we're going to miss you, but I know you have established it with, as you've just said, in our CDC, and that you're going to our national CDC to continue that trust in what is health and science proven. Thank you from the bottom of all of we maniacs. Thank you so much.
Why, thank you. That is so incredibly kind of you to take some time out of your day to call in and share that sentiment. It means the world to me and my family. You're right that the Maine CDC and public health in Maine are going to be in good stead, thanks to Governor Mills, Commissioner Lambrou, and the 500 plus people at the Maine CDC who are doing the hard work every day. Their work will continue, and my work will continue. I'm still going to be working for all 1.4 million people in Maine. I'm just adding 330 other million people into the mix as well.
A tweet here from Ellie. Why won't you encourage people to mask? A vaccine-only approach is clearly not working. We need layered protection.
We absolutely do. Masking remains important, as you just heard me talk about with Ellery. It does not have the same importance as it did earlier in the era without vaccines, in the era without treatments. And that's why things like mask mandates don't have the same importance that they did before. But masking as a public health measure that individuals, communities, organizations can take remains important. There are still groups and places in Maine, theaters and such, where masking is required. That's a good thing. The question on the table is, of all of the various measures out there, which are the ones that I want folks to take on board right now? And for me, based on with the data we have, if there were one thing I could ask someone to do to keep themselves safe from COVID today, right now, it would be to go get the updated bivalent booster. That is really where a lot of the value is. On top of that, measures like masking are important, but it's the bivalent booster that is really doing much of the work.
I mentioned a few minutes ago that we are streaming this, and you can find that on YouTube. You can also find that at mainepublic.org and Maine Calling's Facebook page. I have a tweet here from Piper. I got the bivalent booster in September. Do I get another booster in March?
As of right now, there's no recommendation to do so. There might be at some point, and it's too early to tell. The good thing to know, though, is that bivalent booster that you got early on in September, it's still doing the hard work of keeping you safe. It hasn't necessarily gone away. And even though the nature of the virus has changed, the body's immune system still has that attack plan ready to go, and it can dust that off the shelves if you encounter COVID. So as of right now, there's nothing in the works for March, but in pandemic time, March is still decades away. So much might change between now and then.
All right, we're going to Mason in Waterville. Hi, Mason, go ahead.
Yeah. Hi, Dr. Shah.
Go ahead with your question, Mason. Yep, go ahead.
Yeah, my question for Dr. Shah is, what would you say to the parents all over the country that are losing their children with vaccines? You keep pushing for George Soros and making millions off of the suffering Americans.
Yeah, Mason, I'm glad you raised that. There's been a lot of concern on social media and other places that the vaccines are causing an increase in the number of deaths. Fortunately, this is a question that can be studied and has been studied by epidemiologists and health experts around the world. And at this juncture, with billions upon billions of doses of vaccine having been administered, one thing is clear: the vaccines save lives, particularly when it comes to things like reducing severe illness, severe hospitalizations, and most notably death. Anyone who tells you that the vaccines are the cause of death just isn't looking at the data. I'm glad you raised that, though, because that's definitely something that I've seen floating around social media. And again, thankfully, that's not a question we have to live in fear about. That's an easily answerable question based on the data that we have. And thankfully, what we see with the vaccines is that they are uniformly effective in reducing the numbers of serious illnesses and hospitalizations and deaths related to COVID-19. That is one of the defining miracles of the 21st century so far.
Mason, thanks for your call. We'll move on to Cushing and Ellen. Hi, Ellen. Go ahead.
Hi. I have a question with regard to the rebound effect of Paxlovid, and I'm wondering if research is being done to determine whether a longer course of treatment might prevent that.
Yeah, thank you for that question. The answer is yes. So what you're referring to is the phenomenon that some folks, after they've taken Paxlovid, after they've had COVID, they can sometimes get sick during their course or immediately thereafter. Now, there's a couple things to note there. And the first question is that just a function of the body recovering, or is there something specific to Paxlovid that is causing that rebound? And right now, there's good data on both sides to suggest that sometimes when faced with a tough infectious disease like COVID, even without Paxlovid, some people happen to experience a rebound. It seems to happen a little bit more frequently with Paxlovid. So that leads to the question, maybe we need a higher dose, or maybe we need a longer course. A lot of that is under study right now. Thankfully, rebound, although it can definitely happen, does not occur in the majority of cases. And so for right now, anytime we extend the course of any kind of antibiotic or antiviral, we also have to weigh that with the side effects. So a higher dose of Paxlovid or a longer course of Paxlovid might actually cause more adverse effects, especially since most people don't experience a rebound course. So it's a very delicate balance anytime you're talking about a medication. And that's why the scientists who study this are really some of the brightest minds out there.
Ellen, thanks for your call. Here's a tweet from Maine Public Health Data. 926 fully vaccinated Mainers have died of COVID-19, including 484 since March of 22, 74 of all deaths in the last 10 months. How do you explain that? Will you continue to ignore vital real-world data at the national CDC?
Well, the answer is I will not continue to ignore data because those data don't mean what I think the tweeter is suggesting that they mean. I mean, one way to think about that is what would those numbers have looked like without the vaccine, right? The tweeter mentions about 900 deaths among those who were vaccinated, but what would that number be without the vaccine? The vaccine has saved so many lives. One of the reasons that it's pronounced in Maine in particular is that we have so many people who have been vaccinated. About 95% of people in Maine have had at least one dose of vaccine. So it's not surprising, unfortunately, that some percentage of those individuals have passed away. And that leads to the somewhat misleading statistic that so many vaccinated people have died. Imagine a world in which 100% of people were vaccinated. Every single person were vaccinated. Unfortunately, some of those folks would still die, and some of those would still die from COVID. In that world, 100% of the deaths would have been among vaccinated people. They would be rare, but they would still be at 100%. That's still a better and more effective world than a world without vaccines.
We are speaking with Maine CDC Director Nirav Shah. The last time we'll have him on Maine Calling in this role. We're going to hope he is able to join us from Atlanta in his new job with the US CDC. If you have a question for Dr. Shah, call 1-800-399-3566. Send a quick email to talk@mainepublic.org or find us on social media such as Facebook, Twitter, or Instagram. We'll be right back.
Listener support brings us Maine Calling with help from Northeastern's Roux Institute with scholarships for hybrid graduate programs for professionals across Maine. ROUX.northeastern.edu. And by Eastern Basements, a division of Maine-owned Eastern Mold Remediation, offering basement waterproofing solutions. EasternBasements.com.
I'm Deepa Fernandez. When she was 8, her mother was deported to Mexico. Now 13, Estela Juarez tells her story in a picture book for kids.
I want them to be inspired and to know how much the broken immigration laws hurt family, and that even at a young age, you can change the world.
Next time on Here and Now.
Stay with us here and now, upcoming shortly at 12 noon today here on Maine Public Radio. Our 2022 All Books Considered Book Club season just wrapped up, and we're looking forward to more great books and discussions in 2023, led by our new host, Bill Nemitz. If you've missed any part of last year's book club events and want to watch again, there's some wonderful conversations with authors like Morgan Talty, Jessica Anthony, and Puk Tran. All are archived at mainepublic.org for on-demand viewing. That's the All Books Considered archive at mainepublic.org, and keep an eye out for our upcoming reading selections.
Welcome back. I'm Jennifer Rooks. You're listening to Maine Calling, and today on the program, Dr. Nirav Shah, director of Maine's Center for Disease Control and Prevention, at least till March, when he moves on to the U.S. CDC as second in command. Join our conversation at 1-800-399-3566. Send a brief email to talk@mainepublic.org, or if you're hurry, you can tweet. You can post on our Facebook page, or you can find us on Instagram. Here's an email from Jean. I live in the Lewiston-Auburn area, and for many months, I have been relying on wastewater virus levels from the Maine CDC website to assess my risk of contracting COVID in public places and to calibrate my behavior. In recent weeks, however, the Lewiston-Auburn virus levels have not been updated. Do you know when these data will be updated? In the absence of this information, what is my best alternative source of information about local virus transmissions? Responsible citizen.
Yes, indeed. Well, I'm glad that you're taking a look at those data. As Jean notes, we do put the data from our wastewater sampling on our website as soon as it comes into us. And sometimes there can be delays, whether it's because of the holidays or delays on the sampling side. What's important there, though, is that there are other sources of information, both about local conditions as well as statewide conditions. Just one note there, although there is benefit in knowing what's going on in your immediate neighborhood or in your immediate city, it's also important to keep the statewide picture in mind as well. Indeed, the regional picture, because as we all know, infectious diseases do not abide by the boundaries of a city, a county, let alone a state. So you really want to cast not just a local net, but a regional, if not broader net than that. And fortunately, there are other sources of data to try to triangulate what's going on. One of them are hospitalization data. The hospitalization data are a really effective way to get a sense of the severity of COVID that's out there. And we have those data that are on our website at a statewide level, as well as in broken out reports on subgroups as that. The website that you can also go to, where a lot of the wastewater data are located, is the website of a vendor that we use called BioBot, BIOBOT. And there they break out the data as well in close to real time. So even if the Maine CDC hasn't received it yet, BioBot might have, and you can there go and see what's going on in Androscoggin County.
Great. A tweet from Chris. Where can we get the Novavax COVID-19 vaccine in Maine, and can it be used as a booster?
So the Novavax vaccine is available. It's not nearly as available as the mRNA vaccines, Pfizer and Moderna. So the best place to go to locate the Novavax vaccine is to the governor's COVID-19 vaccine site, vaccines.maine.gov. And there you can scroll and sort by vaccine. Again, the Novavax vaccine is not as easy to find, especially now that a lot of the larger vaccine sites have gone offline. It's not one that's as easy to find. You're going to probably need to look for a community pharmacy or a doctor's office that stocks it. That's partly because demand for that vaccine has not been as robust. The Novavax vaccine as a booster, it's not quite there yet. It's available to younger folks, but not as a booster. So I wish you well. Unfortunately, it is not as well stocked and carried as Pfizer and Moderna, but it is out there. Unfortunately, it'll take some legwork to find.
We'll go to Carol calling from Cumberland. Hi, Carol. Go ahead.
Hi there. Thank you. I just want to thank you, Dr. Shah, for you're being so accessible to us here in Maine, and that's been a gift. And I was laughing actually when I was listening to you, because I was thinking, golly, I remember way back when back in 20 and 21 when we started with this. And there was Dr. Shah was going to be on 3 times a week. And then, oh no, he's only on 2 times a week. And I used to set my day up so that I could listen to you and learn. And you always had something really important to say. So I just want to be sure. Thank you and good travel.
Why, thank you, Carol. That means a lot. And I'm really, really thankful that you were able to find something of value in those. The fact that I'm not around and on TV as much, net is a good thing. It means that COVID is not where it was before, and it doesn't necessitate me disrupting the afternoon soap operas to break in with COVID news. It's very, very thankful, very, very thoughtful of you, and I have been incredibly thankful for the support of just about everyone in Maine.
Carol, thanks for your call. Dr. Shah, you do have an unusual well of stamina, reserve of stamina. What's your secret there?
other than Diet Coke, the truth of the matter is
how could I forget about the Diet Coke? Okay, go on.
So the truth of the matter is I have a couple of sources of strength. One of which, and perhaps the most important, is my family. My spouse, as well as my mom, are around, and even when things were at their craziest, they were there to help me maintain sanity and make sure that I was in the right frame of mind to go out and do whatever needed to be done. The other is, I try to stay active, as do so many people in Maine. But the third, and one that is important for me on a personal level, is I truly love what I do. I wouldn't trade this job for anything, especially if not particularly during the pandemic. There's a reason why public service matters. There's a reason why it's important for committed, smart people to serve in government. And for me, the pandemic in particular exemplified that. Public service really, truly matters. And for me, it's why I took this type of job. It's partly to make sure that the agency was in good stead, but in particular, to be prepared for when the chips were down, to be able to have the backs of every single person in Maine. And I wouldn't trade that for anything.
An email from Mary. Thank you so much for your service to Maine. Could you please discuss the risk of long COVID symptoms to fully vaccinated older people who get mild to moderate COVID?
Thankfully, and I'm glad you raised long COVID. It's something that we don't talk enough about. And thankfully, as more and more data are coming out, the risk of long COVID to individuals who are fully vaccinated and boosted appears to be somewhat low. The numbers change. Some papers put it at 3 to 4%. Some put it at a little bit higher. Some even put it lower than that. So I'm not going to anchor upon one particular number. But what seems to be emerging from the data are that your risk of long COVID, if you are unvaccinated, is significantly higher than if you are fully vaccinated and boosted. This should give the folks of Maine solace, because people in Maine are, by and large, highly vaccinated. In terms of older Mainers, those 65 and older, we lead the country in the percentage of people who are fully vaccinated and boosted, about 2/3. We're in the number one spot among all states. Long COVID is still a risk, but if you have done the work to get vaccinated and boosted, it's thankfully not something that is the majority condition.
A tweet from Patrick. Any thoughts on what the CDC can do to improve messaging about public health measures with regard to the pandemic and infectious disease at large, considering the resistance and hostility we've seen to the same over the last 3 years? And Patrick doesn't say whether he's talking about Maine CDC or the US CDC, but I'm going to guess it's the US CDC. What can the CDC do to improve messaging?
I'm glad Patrick raises that. The first thing is to recognize that messaging to the entire country is very difficult, to say nothing of the entire world. To go back to what I said a moment ago, a lot of people in the United States think that the response to COVID was completely overblown and we did way too much. And then a lot of people think that the response to COVID was completely underdone and we didn't do nearly enough. In light of those two large camps, how do you message when polarization and the strength of belief that we either did way too much or not enough is very, very split? Messaging there is very difficult. However, that being said, there are, I think, one or two things that I am hoping to bring to the table at the US CDC level with respect to messaging. The first is a better appreciation for the ever evolving nature of science in a pandemic, right? So in a pandemic, science is not like 2 + 2 = 4, which was true 2,000 years ago, and it's going to be true 2,000 years from now. Science in a pandemic is very much something that we can and should expect will change. And although the CDC, as well as the Maine CDC, even though we said that, I don't think we emphasize that what we know today will invariably change. And that's not a bad thing. That's science and all of us getting smarter day after day after day. The other is clarity. Sometimes public health officials shy away from clarity because it means that some folks are upset with what you say, or that you have to hedge your answer in so many ways that the signal is lost from the noise. Jen, as you know, one of my approaches to public health communication has been that if somebody asks me what time it is, I don't tell them how to build a clock. I just try to tell them what time it is, even if it's not the time they want to hear. And I think that degree of clarity can really help improve the messaging.
We'll go to Kenny Bunk and Charles. Hi, Charles. Go ahead.
Hello, Dr. Shaw. First of all, thank you. Your television sessions were the only thing we listened to during COVID. It was a terrific oasis of calm. I questions. One is the national CDC. I thought was behind the 8 ball in terms of advising the legislation, the need for the stockpiling materials that we were short of going into the COVID session. And those same materials, by the way, would be used, I assume, for germ warfare, et cetera. That's number one. Number two question relates to Maine and to national is the confusion about the number of flu deaths that were going on simultaneously with the COVID. I can never get clarity on that, how like 30,000 people that die annually from flu or whatever the number is suddenly disappeared. And could you answer that? Thank you.
I'm more than happy to. First of all, thank you for your kind words as well, sir. I very much appreciate it. On your former question, you're right. Stockpiling of things like PPE will be and has been critical. The PPE that we at the Maine CDC have in reserve is useful not just for COVID, as you suggest, but a host of other diseases, whether they are respiratory or diseases that are introduced through nefarious means. So having and maintaining a good national stockpile of materials, supplies, and medications will continue to be essential. And I'm looking forward to working with our colleagues across the states, across the countries to keep that stockpile up. Your second question was around flu deaths. Flu deaths, thankfully, went down significantly during the pandemic. And that's a good thing. Some of it was because of social distancing and masking. Others, some speculate, may have been just because of the way that respiratory diseases compete with one another. It's really too early to know. But one of the things that we've seen, thankfully, is that flu deaths have not resumed to the severe pre-pandemic levels as before. They might still, because there's often a second peak in any flu wave. So it's possible that in March, there will be a resurgence of flu. But thankfully, because of more awareness around respiratory diseases, we believe that more people have gotten their flu shot, as well as are practicing smart common sense measures to avoid exposure.
Charles, thanks for your question. An email here from Susan. Susan says, you announced you were leaving and I immediately got COVID for the first time. Coincidence? In all seriousness, I'm wondering about resuming exercise during and post-COVID. I'd really like to hop on my cross-country skis on this snowy day, but I'm 5 days into having COVID and wondering if it would be risky to my cardiovascular health.
Susan, I assure you that that's an example of where correlation does not equal causation. In terms of exercise, you want to take it at your own pace. You really want to make sure you're through your 10 days of isolation before you're out there huffing and puffing, potentially around others. And then after that, you really want to do what your body says. Cross-country skiing is intense, so it may take longer to get back up to that level than it would from, say, walking around the block. So take it easy. You'll get back there.
Okay, we're getting so many emails that are just thank yous. And I'm going to read a couple. This is from Catherine. My mother is happy for Dr. Shah being able to move to bigger and brighter things, but she's been crying this whole hour. She says his daily updates made the pandemic bearable for her, and she wouldn't have been able to do it without him. Thank you, Dr. Shah. I know that sometimes you've been overwhelmed by the emotion people have when they talk to you.
It's gratifying. It's always gratifying. That support has translated in Maine to high vaccination rates and low infection rates. It's very, very gratifying.
And then here, this is really fun. This is from Donna. I think that a great song that encapsulates Dr. Shah's service to us is Don't Stop Thinking About Tomorrow. Knowing he was always doing that for us gave me and others a great deal of comfort in the uncertain times we were in. So I have a feeling we're going to have more suggestions. Go ahead.
That is also very kind. You know, I earlier said Lovely Day by Bill Withers, but perhaps a better song would be the Beatles song, I Get By With a Little Help from My Friends, because we all got through this together.
All right. And Doreen says, I remember you were invited to do a cooking segment on the 207 program. Will you film that episode before you leave?
I will try.
I'm sure
to.
Rob Caldwell is happy I'm asking that.
I will try to. I love to cook and I love to talk about cooking. So I'll try to make that happen.
Oh my gosh, Dr. Nirav Shah, it's been such a pleasure to have you on the show today. And the other, we think something like 40 times. Can't wait to welcome you back in your new role. Good luck to you in Atlanta.
Thank you all. Thank you all.
Dr. Nirav Shah, of course, is director of the Maine CDC. Today's sound engineer was George Thomas. Maine Calling is produced by Cindy Hahn and Jonathan Smith. Tomorrow on the program, the rental crisis in Maine and efforts to help renters in need. I'm Jennifer Rooks, and you've been listening to Maine Calling on Maine Public Radio.